Chris, we asked Chris to talk. First of all, what do you do at the Hawaiian Eye Center? Lots of stuff, right?
I'm an ophthalmologist and IMD. We take care of all kinds of eye problems, eyeglasses, eye exams, eye surgery, all right at our center there, Hawaiian Eye Center.
Something that we've noticed that a lot of people have, and maybe it's just looking at computer screens all day, like we do and so many people do. Dry eyes. Anybody here with dry eyes?
Dry eyes.
You. Really? Okay. You have 5 customers here.
Common problem.
What do you do?
Well, it's interesting because when we stare at the computer all day, what happens is it interferes with our blinking. So we got our iPhones and our iPads and our Android phones and all these things, computers, TVs, we're staring at them all day, and we don't blink properly. When you blink, that moves the upper and lower lids together. You end up releasing a little oil from the oil glands in your eyelids, and if that oil is not properly released and spread onto the surface of the eye, the tear film evaporates too quickly. So you end up with dry eye from evaporation. We call that evaporative dry eye syndrome. Okay? We can treat that now. We actually have some in-office procedures that we can use that if those oil glands are not working properly and you're tired of doing warm compresses and eye drops and other things, we actually have a little device that fits under your eyelids and puts a little heat on the lids to loosen up the oil and the oil glands, and then does a little massage of the eyelids. It's kind of like having a spa treatment for your eyes, just to relax and enjoy it.
Wait a minute. You know something there that gives you a little eyeball massage?
Exactly, eyeball massage. Opens up those oil.
Okay, and there's lip drops and things like that. I mean, the stuff you're going to get, if you just go down to Long's to the dry eye counter, you're going to get over-the-counter stuff. But for people with a really serious problem, they're going to go see you.
Even the over-the-counter ones, you know, we can make a difference which over-the-counter ones we recommend based on diagnosing the dry eye properly. So if you have this oil gland problem, what we call, it's got a long fancy medical name, you ready? Meibomian gland dysfunction. Okay, so the meibomian glands, the oil glands, don't work right, you don't get the right oil, and the tear film evaporates more quickly, and that gives you the symptoms.
Let's ask a big question. Does it hurt?
It doesn't hurt, no. No, it's comfortable, like a spa treatment. You relax, heat. It takes about 12 minutes, just 12 minutes and you're done.
Here's Dr. Price. He's been a football player, a football coach. He's been a boxer. He has done virtually everything. Karate. Show him a needle. He's under the table. What happened? What happened? Did you have a bad experience with the needle sometime?
Oh yeah.
Yeah?
Oh yeah. Nothing like a nurse that's going on some kind of union negotiation to strike with a dull needle.
Dull needle. Okay.